There's still plenty left. You couldn't even see what.
All right, all right. The time now being, well, over here it says 9 a.m. Up there it says 9:01. I'm going to go with 9 a.m. because we're on time today. I'd like to call this meeting to order, Kane County's Public Health Committee for Wednesday, February 18th, 2026. Clerk, please call the roll.
Gripe. Gums. Oh, me? Oh, sorry. Sanchez,
Sanchez present.
Arroyo,
Right here.
Juby,
Over here.
Genesis,
Hennis here.
Carver, Young.
Here.
Strathman.
Strathman here remote.
Okay. And then remote attendance requests from Ms. Strathman. Anybody else? I'm not aware of anyone else. I think everybody else is here, actually.
Yeah.
Yeah. Okay. No objections?
Objections.
All right. It's a little weird being in this seat. It's been a few years, huh? So I need an approval of the minutes, January 21st, 2026. Can't even talk yet.
Hennis will move for unanimous consent of approval of minutes for January 21st, 2026.
Any objections? Hearing none, minutes are approved. Public comment. We have one signed up that I'm aware of, Dave Young. You're up.
David Young. In the U.S. Constitution, the First Amendment provides that Congress shall make no law abridging the freedom of speech. The phrase abridging the freedom of speech means the government is prohibited from punishing or censoring individuals for what they say. The clause applies to federal, state, and local governments, including the Kane County Board. First Amendment retaliation refers to adverse actions taken by a government official in response to an individual's exercise of their First Amendment rights. To demonstrate First Amendment retaliation, an individual must show the following. 1, they engage in expression protected by the First Amendment. 2, a government official took adverse action against the individual. 3, the individual's protected expression motivated the official to adverse action. We have a couple of people on the Kane County Board that have committed First Amendment retaliation. Courts have repeatedly held that state and local officials cannot retaliate against protected speech, suppress speech based on a viewpoint, use government authority to silence critics, and coerce third parties into helping suppress speech. 42 U.S. Code, Section 1983, is a federal civil rights statute that allows individuals to sue state or local government officials for violating their constitutional rights. Possible remedies from a civil liability lawsuit include monetary damages, which could be from emotional stress, reputational harm, chilling of speech, financial loss, ongoing harm caused by retaliation or suppression, violation of constitutional rights. These civil rights damages often exceed tens or hundreds of thousands of dollars. And then there's punitive damages. If the official's conduct was malicious, reckless, willful, or intended to suppress or punish constitutional rights, these damages can be substantial. And then, of course, you have attorney's fees, litigation expenses, and court costs. So when you use your email to make a call to action against another person, whether it be a public official or a private citizen, you are committing First Amendment retaliation. So I want to make sure everybody knows about that.
Okay, I'm not aware of any other public comment. Right, okay. The finance reports are always online. If you have any questions, you can reach out to Cannell. Next up, animal control.
Good morning, everyone. All of my reports are on file. If anybody has any questions about my numbers at any time, I'm always available and would love to go through them with you. Just a reminder, our first vaccine clinic is April 25th. That is going to be a Saturday. That'll be 10 a.m. to 1 p.m. We're very excited to get it going. We've already done a few press releases, a couple of things getting the word out there, and that'll get stronger as we get going. We've already received dozens of calls about this, so people are excited. And we'll be turning over our website shortly. Remember, February 20th is National Love Your Pet Day. So that's very important. Everybody gets lost in Valentine's Day, but National Love Your Pet Day. It should be every day, but it's officially nationally on the 20th. So that's all I had this month. If anybody has questions for me, I'm always available.
Any questions? Juby?
I do. I actually, going back to your report.
Yeah.
I know you mentioned why this is, and I just can't remember. Why did we have 1,000 dogs get tagged or 1,000 animals get tags last year, but only 132 this year? I can't remember why.
We use a computer system to now get everything loaded in. It does load faster, but it is dependent also on when we receive them from the vet. Then we have to scan them in, then they get inputted in digitally. So it's a process
Okay.
that used to be, we were 6 months to a year behind entering tag data. Now we're 1 to 2 months behind. So yes, hopefully that data is coming. It's been scanned to them. I know yes.
Okay.
But it is coming.
So it's just changing over.
Yes, it is a turnover in the way it has to get loaded. But again, compared to the way it used to be, we are months faster of getting this data
Okay.
loaded and more accurate.
So we didn't have 1,000 animals inoculated in
No.
1 month.
No.
That'd be busy.
That is just all the certs that were loaded between the start of this fiscal year and when this report was run.
Any other questions for animal control? Thank you, Brett.
Thank you.
Okay, next up, we have a resolution.
Yes.
Actually, authorizing number of procurement cards issued to animal control and each of their transaction limits. Need a motion in a second.
Royal moves.
Harper seconds.
Row moves, Tarver seconds. Any discussion? Mr. Youngstead.
May I just remind everybody, this is a single King County Animal Control credit card. My name may be on it. I do not carry this card. It is literally locked up in the county safe. This is a facility credit card. It is not a personal credit card. That's why the limits are set where they're at. We have had automotive things. We upped our limits, I think it was a year or two ago, because we've had some automotive issues as we're going through the process, turning over all of our vehicles. Where it did go above our $10,000 limit, that's where we talked with everybody. 20,000 made more sense because again, it's a facility credit card that is used for our vet care, our emergency care, emergency purchases, things like that. If anybody has questions, please let me know.
Okay, any questions? All right, clerk, please call the roll.
Arroyo,
Oh, yes.
Juby,
Should be I.
Genesis,
Genesis, yes.
Carver,
Tarver, yes.
Young,
Yes.
Strathman,
Yes.
Sanchez.
Sanchez, yes. Okay, resolution passes. Thank you, Brett.
Thank you.
Next up, Mr. Executive Director.
Good morning, everyone. Just a couple things I want to highlight this morning. Number one, it is almost time for us to start our next community health assessment process. So again, in Illinois, to be a certified local health department, we have to go through this process every 5 years. About 20 years ago or so, we decided to get on a 3-year cycle so that we're in alignment with the IRS requirements for our hospitals here in Kane County. So we get a much better assessment process when we do it together with our 5 hospitals. We also include the 708 board for the Southern Townships in Kane County. So you'll be hearing more about that. And I just want to bring that up because this is an opportunity for us to engage you to see what you think the important health issues are that are in your district. So we will look at all the hospital data. We'll look at all the causes of illness, the causes of death. We'll look at doing surveys where we get a statistically significant, usually around 2,500 surveys of Kane County residents. We'll host focus groups. We'll do all those good things, but also getting your input is really important. So over the next couple of months, you'll hear more about that. Also, I do want to bring up that unfortunately, we did just identify the first case of measles in Illinois this year in the East St. Louis area. So that is something we're keeping an eye on. I'll share a chart next month with you, but I saw something that was kind of striking to me as we talk, and we've had the discussion about the small number of cases relative to things like heart disease and things like that, which is true in overall volume. Things like measles that are 100% preventable with vaccine. Again, we had eradicated measles in this country. So now it's disturbing to see it coming back. We have been seeing vaccine rates going down in Kane County over the last 10 years. So there's still pretty good. We're just a shade under 95, just using measles as an example, we're a shade under 95% protected in our school districts right now. The goal is 96%, so we're a little below that. But we were up above 98% 10 years ago. So we're seeing a decline. We're seeing more people take exemptions. And the issue with this is literally it can cause children to die. So we have had our first case in Illinois already in 2026. We've had significantly more cases year to date in the United States than we've had in the past 5, 10, 15 years. We've seen an increase every year. So this is just starting to be kind of exponential growth that we're seeing. So this is something that we do want to stay ahead of. So I don't know if there's any questions about that. We do have pretty good access to vaccine here.
Mr. Chairman, could I ask a
Ms. Young,
question?
go ahead.
Kim Young. Hi, Michael. I don't know what, so it's come to my attention that there's a certain age group, my age group, that were pre-MMR and didn't live through the outbreaks of measles. And as a result, we are not immune. I'm 69 years old. So what are we doing to inform that community that they may not have immunity to measles and their unvaccinated grandchildren may get to share it with them?
Right. No, great question. And that's the thing, is that we are looking at all ages here. So as you mentioned, typically we look at, and is it 1957 is the birth date that if you were born before then, you probably have natural immunity because you unfortunately experienced measles being rampant in the community. But after that, we typically are looking at vaccine records for people who may be exposed. So I think this is why it's important that I sometimes will compare vaccines to like drinking and driving, that it's not just you, it's other people that you may be making sick. So your question's a good one. We're not currently pushing for people to go out and get new vaccine, but I don't know, I'll look to Director Barrett or Onwuda. I mean, typically we will look if there is a case where we're doing contact tracing, we'll work through the guidance at that time to see, and it's people have to show proof of vaccine. But protection is a different thing. And then even though we talk about these being preventable, no vaccine is 100%. So even if you are fully vaccinated, vaccine can wane, the efficacy of it can wane over years. So it is something that keeping the cases from showing up in your community is the best thing for us to do, because it's all statistics, right? Your likelihood to bless you is much lower in that case. But we're not pushing a big vaccine campaign necessarily for
Old people. I didn't say that.
I me neither. Yes. Great question though.
Mr. Panessas.
Federal funding for vaccines. Is there any thoughts on whether or not that's going to be impacted, especially since we have these outbreaks now occurring? You would think that they wouldn't do it, but
I think federal funding is probably there is so much uncertainty with federal funding right now for all things public health, and especially for states like Illinois. It is fairly common, unfortunately, right now for us to get notifications, and you see it all in the news, that millions, billions of dollars are being pulled back from Democratic states, usually 4 or 5 key states. We just had this happen a week ago. That's typically followed by lawsuits. The Attorney General in Illinois has been quite aggressive. If you'll remember, we did have a grant that was $1 million that was canceled out. That's still in the courts right now. And that was, going on almost a year. To March, I think, is when we received that notification. So there's no one answer to your question, and specifically about the vaccines, because there are continued threats against funding for public health initiatives, and this goes for behavioral health and more core public health. One thing that I as a public health professional think is really a positive is that the State of Illinois has decided to go along with the American Academy of Pediatrics for their vaccine schedule. So we have seen a shift away from what's the long held science on vaccines and a reduction in what vaccines are being recommended at the federal level. The folks who make those recommendations, the experts were purged at the federal level, and people with questionable scientific background were brought in. So this is an area where this is a positive that we are still aligned with the American Academy of Pediatrics, which is the member organization that takes care of our children for the pediatricians in this country. So we still have their schedule that we're following. So that's good news at least, but it's still a threat, like you asked. Access, if things are not covered and going up more towards adults, whether it's influenza or COVID, if things aren't covered because they're not under the national purview, that can create access issues for us. So there is, we have this dichotomy of people who are opposed to, say, COVID vaccine, and you have other people who desperately want it, and because of their insurance, they're not able to get it, or it's out of pocket and it's hundreds of dollars. So that is a barrier to getting care. So we continue to monitor it.
We have one follow-up. I mean, state budget, I just read in the Tribune today, they're looking at a maintenance budget according to the governor. Is there going to be funding, with the funding at the federal level, kind of iffy as it is right now, it's at least going to be delayed for, Illinois and a handful of other Democratic states. I don't think we could rely on the state to provide any of this funding. So you're gonna have a tough job, I think, for the next couple
Tight times, yeah. And the governor's budget address, of course, is at noon today. It is going to be it's a tight state budget anyway. That's before you even add all the extra issues with the federal. A lot of the dollars that come to us at the local level, even if it's through the state, it does come from the federal government. So it's challenging.
Yeah.
Mr. Chairman, Allen.
Hold on, Mr. Young, did you have a question?
I did.
Okay.
well,
and
I just-
then Alan.
See, what I heard Michael say is that the person that's in charge of, which would be Kennedy, that's in charge of our federal health department, so to speak. You're saying that he's wrong and that we need to follow what Illinois is saying. So it sounds like you're making this completely political. And I don't think that's on either side. I think that's very bad. Okay. And I think that when you have too many vaccines, why do we have so many vaccines? I don't know the answer to this, but apparently Kennedy thought that there were too many, but you're saying he's wrong. So we're going to follow out what I think Illinois says. Is that what I'm hearing?
Not those words. You raise an interesting point, but I think I 100% agree with you that we should take politics out of this. So I think looking at the research and looking at the data that we have around vaccine safety, around vaccine efficacy, this is where we're looking at the long held research. We're looking at areas where people sometimes put research forward that ends up not being true. And so I think following the science is what we're trying to do. And the American Academy of Pediatrics is a group that I think is still doing that. So it's not that one person's right and one person's wrong. It's just trying to find the research that is not political. And that the head of HHS is always a political appointee. That person is rarely a researcher or a physician or a scientist. So I wouldn't put it on a person or a personality, but those people typically will depend on national experts to come up with the information. So I partially agree with you, but then partially I don't think it's exactly how you framed it. What I'm trying to say, at least.
It's awful.
Ms. Allen?
Thank you, Mr. Chairman. I think whenever we're dealing with science, it's always best to follow the data if we possibly can. So, Michael, thanks for doing your best to do that. I wanted to just mentioned that the health assessment process, if I'm remembering correctly, has a cost attached to it. And by virtue of our doing this program with our hospitals, with our other health professionals, aren't we also sharing that cost every several years? I'm just trying to reinforce my memory, Michael. Thank you.
Yeah, yes, no, thank you. And that's an excellent point. And I think that's an added benefit of us working together with other partners to do this assessment together is not only is it saving us money, it allows us to do a much more robust assessment by working together because we're able to have a bigger budget, but also it's better for the community because otherwise each of these entities would be doing this independently, which is much less
We're always
efficient.
trying to, we tend to go into our silos. And I think it's always better if we can combine our silos, which is what the county tries to do. And thank you, Michael.
Yes, thank you. Great question.
And with the assessment too, you mentioned working with the Southern Mental Health Boards, the Inc. Board, the Inc. Alliance. If we could somehow include Elgin and Dundee, and that would be great.
Absolutely. And we're at the beginning. This is a, hey, stay tuned. So we're actually just meeting with our executive committee that's made up of these funding partners next week, I think, to start talking about the timeline. So adding Elgin and Dundee, we'll get an invite out for sure.
Cool.
Great idea.
Any other questions or comments for this section?
I got one more comment.
Mr. Young?
Yep, David Young. I think what I've seen is that when what's coming, let me back up. I think an article that I just saw within the last week or so, it's going to allow individuals to sue vaccine providers and health companies if that vaccine is dangerous. And I think that could actually help weed out a lot of these vaccines, because if they are dangerous to just a couple of people, maybe they will be pulled off. Because right now, from my understanding is that this is done back in the Reagan days, is that they gave these pharmaceutical companies basically immunity to develop these drugs. And so that's where we have all of these vaccines and stuff right now. But just hopefully that something is coming down the pike that will even out that playing field.
Sure. And I do think, I mean, nobody's a fan of bureaucracy, but I think it is a positive that in this country that we have so many steps to drug approval. And there are so many trials and so many things that occur for something to reach the market in many cases, which, you know, ironically, and it's something our team, Director Peterson's not here today, but, you know, you go into a gas station now and you can buy about 10 different unregulated drugs and kids can get them and things like that. So that's a big issue. But with vaccines, those are very well studied and we're constantly monitoring it. So there's some good checks and balances in place for sure.
Any other questions, comments? Okay. Great. Thank you, Mr. Isaacson. I know we have a few resolutions. So I need a motion and a second for authorizing the number of procurement cards issued to Kane County Health Department and each of their transaction limits.
Roy moves.
Royo moves.
Tarver seconds.
Tarver seconds. Any discussion? Is there anything notable about this?
No, I mean,
Well, it's
I'll
routine.
echo my colleague here. This is our one King County Health Department credit card. So we keep it locked up in a safe and
Even
people
if
are
you
just able
didn't,
to
we
access
still
it.
see the invoices.
Yeah.
We still see the bill.
Every invoice, correct. Yeah.
Okay, hearing no other discussion, clerk, please call the roll.
Ryo,
Oh, yes.
Doobie,
To be I.
Genesis,
Let him die. Genesis, you're up.
I'm sorry. We're having a private conversation here. Sorry.
It's a yes vote or a no vote.
Oh, I'm sorry. Penis's, yes.
There we go.
Yep. Tarver,
Tarver, yes.
Young,
Yes.
Strathman,
Yes.
Sanchez.
Sanchez, yes. The next resolution, authorizing a professional services agreement with medical director for Kane County Health Department. Need a motion second.
Tarver moves.
Carver moves.
Penis's second.
Doobie seconds. Discussion. Michael, can you just briefly walk us through this?
Sure. So for about 25, 30 years, we have had a partnership with Advocate Dreyer, where we've contracted with them and they've provided a physician who served as a medical director for the health department. A little over a year ago, we received notice from Advocate that they were ending that relationship. Actually, they discontinued their infectious disease program at Dreyer. So the physician was no longer employed there. We did, and I want to thank the folks at purchasing and Director Barrett. We put together a request for proposals and put this out to bid. Now, a couple notes. Kane County does not provide medical malpractice insurance as a practice. So with contracting with a health system, they had malpractice through that. With this, now we're asking a provider to have their own medical malpractice insurance. As a result, the cost is going up a bit, not only for us, but also for the provider. We actually went through several cycles of putting this RFP out. But I think we have identified a really fantastic provider here who has a lot of experience in a lot of different areas. Treating our TB patients is the number one thing that we're working on. But I think with this physician, we're going to be able to expand. And as we look at behavioral health and other things that are going on, certainly writing all of our standing orders and things like that, this Dr. Anthony Rizzo is going to be a huge benefit for Kane County. So this is $45,000 for this contract. It is renewable. Again, thank you to purchasing for helping us go through a competitive process. And we are assured, and I should thank our friends in the state's attorney's office too, because we work closely with them through the whole time to make sure that we have all our I's dotted and our T's crossed. So this is going to be exciting, and it is budgeted. That was the other thing I was going to say.
Excellent. Any questions or comments? Mr. Young?
Hi, David Young. So I was looking at this and there's several items on I guess it'd be the request for purchase, I guess, the RFP, where it mentioned several line items that Dr. Rizzo would be responsible for. And it brings up the M tuberculosis bacterium that causes tuberculosis and checking for that. And then I started doing some research on tuberculosis, and it was through, my little Copilot AI. But what it showed is that in Illinois, there are 353 of those cases in 2023 and 2024, but there's no record showing TB in Kane County over the past 10 years. So I just wanted to see if that was still the case, because my research didn't show that. And so, obviously I didn't look at every article, but
yeah, no, that's not correct. We're managing 4 cases right now. I actually should have somebody else to thank. Maybe you remember, we did enter into a temporary partnership with the Winnebago County Department of Public Health, and they've actually been covering for us in this gap period. And we're keeping them plenty busy. So did we have up to 10 cases at once this year at one point?
So in
This year.
2026.
in
Within the last year, I should say.
2024, we had 13 cases. 2025, I believe there was 11 cases, if I remember. Cases last about anywhere from 6 to 12 months of treatment. So we have some of those we have no new cases since January 1st of this year, but we're continuing to monitor, work with daily with 4 cases that were started last year that are still continuing into this year. Hopefully that answers.
But we could do next month, a more detailed overview of the TB program, because it is kind of the core of public health funding in the state of Illinois. And I think it's really interesting. So if you'd like to see that and what we do with daily observation of people taking their medication and things like that, we could do that.
Okay. Juby?
Aren't we required by state statute to have tuberculosis monitoring? Even if we have 0 cases, we still are required by law. So,
Yeah.
There was a TB levy before there was a Kane County Health Department, right?
Well, because tuberculosis historically has caused the most deaths out of any disease, right? Isn't that?
Yeah, malaria may be number 1 and
Okay.
worldwide, but
Yeah.
Mosquitoes are the deadliest.
We
critter
don't
out
think of
there.
it as being very
Right.
active anymore, but.
But we do have a
historically was.
good, there's not, in the United States, we don't recommend vaccination. There's some countries that do vaccinations, but we don't see we don't believe in the efficacy of that. But there is good treatment. So there is a way we can curtail it if somebody does have a case.
Juby again.
Okay, so I had a brilliant thing that's what says in state statute. I'm going to negate that by this stupid question. Brett, can any type of livestock get tuberculosis? Do we watch it in swine or cattle?
State level does.
The state level does. So even, we're not just talking people. We're talking, okay. So I didn't negate my brilliant question. All right, thank you.
You're an epidemiologist. I knew it.
Mr. Chairman Allen,
It is a fancy word. Alan, go ahead.
because I've been around for a while, I just want to remind people that maybe around 15, 20 years ago, we had an outbreak, I think, in Aurora. Michael, maybe you can help me out here. But the thing was that it was among people who were, if not homeless, at least marginally cared for. So it not only spread, but it had the danger of spreading a lot more. And one of the tricks is that, yes, you can help these people with medication, but they won't necessarily come to you. So we actually housed some of those people so that we could make sure that every day they were getting the treatment they needed. And that's how we were able to blot out that that spread among those folks. Michael, maybe you can fill in the details that I'm not remembering.
Yeah, no, thank you. That was a really tough situation. It was the second largest outbreak in the country. So it was a lot of effort and energy went into it. Compliance with medication is key. So, I mean, we have something called DOT or directly observed therapy, where making sure that people are taking their medication that's the essential thing to do. But that case, and I don't remember, I could look up, I don't remember off the top of my head how many cases we had. And that was probably 15 years ago. I think, Miss Allen, you're right. But it was a big case, and it was a vulnerable population that had a lot of other issues. And it's something that, to protect other people in a household, that is an intervention in public health sometimes that we would do, is put someone in a motel so that they could be away from other people during the infectious period. We haven't had to do that for a little bit, though.
Mr. Young.
That did come up on Copilot, 2007 to 2011. And it was from the homeless community in St. Charles. So there's like, I don't know, 30
This
people.
one, the big one was in Aurora. Yeah.
Okay.
Maybe what you saw was where they were housed.
I'm sorry, Sid.
They were housed in St. Charles
Oh, okay.
out west. I think they knocked down the building, the hotel,
Yeah, Serengeti,
Serengeti Hotel.
about 47.
It's before my time here. So, any other questions on this? Okay, clerk, please call the roll.
Arroyo,
Yes.
Juby,
Should I?
Genesis,
Hennessy's yes.
Carver,
Carver, yes.
Young,
Yes.
Strathman,
Yes.
Sanchez.
Sanchez, yes. All right, next resolution authorizing reclassification of housing manager position to Assistant Director of Planning and Information Management for Kane County Health Department. I need a motion and a second. Carver moves.
Hennessy's second.
Hennessy's seconds. Can you describe this briefly, Mr. Isaacson?
This is part of the transition of housing programs that moved over from the former Office of Community Reinvestment. Those programs, of course, were split up between the Development Department and the Health Department. We did absorb 3 main programs as part of that, and 5 staff. We have a vacancy in one of those positions that came over to us. And now that we're getting acclimated, we're not a year into it yet, but now that we're learning all the new language of HUD and all the different systems, we're still working to get access to some of the systems, as a matter of fact. But it's quite an onerous process to run these programs. They're excellent programs to help people who are struggling with housing, including rental assistance and what's called the continuum of care, where we work with the providers for shelters across Kane County. What we're asking for today, and this is a change with the personnel policy that passed a few years ago, where now department heads need to come in and seek permission from the board to reclassify positions. So what we're looking to do is move this position that was at the manager level. We want to create an assistant director position with that. This manager position did have one person reporting to them. What we'd like to do is actually continue that with that one person, but then add 3 additional people, 1 manager and 2 specialists from our rental assistance program, and also put the planning initiatives under this so that we can create a more cohesive unit and get the support, because this is a tremendous amount of work to do this. And thank you to Director Holloman, who's taken all of this additional work on since these programs came over. There's not a request for a budget adjustment because actually OCR, the Office of Community Reinvestment, had already had these positions at a higher salary level. So the budget is already there. We just need your permission to change the grade for the person so that we can post it.
Any questions or comments on this? Hearing none, clerk, please call the roll.
Arroyo,
Oh, yes.
Juby,
Juby, I.
Genesis,
Genesis, yes.
Tarver,
Tarver, yes.
Young, Strathman,
Yes.
Sanchez.
Sanchez, yes. Okay, no old business that I'm aware of. I need a motion to place the reports on file. Unanimous consent works. Tarver asked for unanimous consent. Hearing no objection, the reports are on file. We have no actual need for executive session to discuss. Well, we don't have to go into executive session to discuss the release of closed session minutes. But we do need to vote on the release of the closed session minutes. So I will entertain a motion in a second.
Royal moves.
Royal
Second.
moves. Young seconds. Assistant State's Attorney Ford informed me that we don't need to actually go into closed session because it's only the release of the closed session minutes. Is that correct, Mr. Ford? It's not working.
Because the committee reviewed the closed session minutes last month, all you need to do is that you reviewed.
Microphone, please.
It's not working, but essentially since the committee. Oh, try one more time.
Is it working? Yeah.
Oh, there it is.
All right. Thank you,
Right.
Chair Sanchez. Stephen Ford from the State's Attorney's Office. Last month, the action item wasn't on the agenda, so we went into closed session to review. This month, it's just to vote on the release of closed session minutes as outlined in Exhibit A that you reviewed last month.
And there it is. Okay. Any other questions or comments? Clerk, please call the roll.
Arroyo,
Oh, yes.
Juby,
Juby, I.
Genesis, Tarver,
Tarver, yes.
Young,
Yes.
Strathman,
Yes.
Sanchez.
Sanchez, yes. Okay. Chair's comments. Ms. Strathman, do you have anything? For chairman's comments?
Not today, thank you, but thank you for filling in for me. I really appreciate it.
No problem. All right. No new business. Adjournment. Motion and second. Booth,
Second.
Young seconds.